register all the members of a household, and they will conduct assessments for children who are under 5 to check on pneumonia, malaria, and diarrhea. They will also assess pregnant women who may be at an onset of a pregnancy or much later. When they find something that is unusual on these assessments, they are trained to refer to a health facility where further care can be provided. The data is received and visualized in dashboards that help to inform the health system managers the status of the community. Health system managers can also use this information to determine where services should be sent. They can use it to tell where outbreaks might happen, and most importantly, they use this information to help determine supplies and materials that need to be distributed to the community.